Right then, so fingers crossed we're in. Apologies everybody who's already joined. We were experiencing very last second technical issues, and as a result you probably can't see, like I can't see Pat. I saw a glimmer of colour there. Oh, we have Pat. I can see you, Pat. Amazing.
Thank you.
Fantastic. Okay, well, we'll kick off on time. So thank you all for joining us for this webinar where we look at the topic of mental health in the workplace. Appreciate you all dialing in, probably on your lunch breaks. Quick introduction from myself. I'm Matt Norbury. I'm the founder and CEO of Each Person. We're the employee benefits platform that focuses on three key areas. The first is bringing together the best benefits all under one roof. The second, delivering that through tools to help reduce the HR admin associated with managing schemes. And finally, helping organizations fight climate change. We started purely as a recognition provider. So I've seen firsthand over the last 7 years the link and impact that appreciation has on people's esteem, which is part of mental well-being. And we now support hundreds of thousands of UK employees doing recognition, reward. We protect financial well-being and mental well-being. And more recently, we expanded across 42 odd countries. Our latest innovation is the launch of our HR consultancy arm. The consultancy division aims to help people within the HR world in organizations of all sizes, sort of to demystify the whole world of employee well-being. And this is led by Graeme Weymes. So I'll hand over to Graeme to introduce himself.
Thank you, Matt. Good afternoon, and thank you so much for taking the time to join us this lunchtime. A little bit about my background. After many years supplying hospitals with clinical products, I worked for Bupa for around 10 years, providing bespoke health insurance schemes to large corporate organisations, before then managing an employee assistance provider and a healthcare consultancy business. I then worked in the HR space, supporting companies with outsourced payroll, HR services, and yet another employee assistance programme, before moving on to the Priory Group, where I managed an acute hospital for 10 years and then ran their Middle East outpatient operation before coming back to the UK earlier this year. So this background is quite helpful in understanding the needs of companies, especially the need to build an open culture, how to identify mental health issues and support colleagues through their difficulties, whilst respecting the parameters of commercial, contractual and policy guidelines. So without further ado, I'll pass you back to Matt.
Thanks, Graeme, for that introduction. At Each Person, we've also built a really exciting ecosystem of partners to help deliver these great benefits. And one of those partners is Care First. So I'd now want to introduce, or let Pat from Care First to introduce herself.
Hello, everyone, and welcome to today's session. We're going to look at how managers can support their staff in terms of their mental health. I'm Pat Garland-Smith, and I'm the training manager from Care First. I've been with Care First a very long time, actually 28 years from the beginning of Care First, initially as a clinician and later becoming a training manager, also with responsibility for customer experience. So quite a breadth of experience there. My main interest is helping managers help their staff with mental health issues. It's still a very stigmatized subject, unfortunately, stigma-laden subject. And really, I'm hoping to get people talking about it more openly. Same as physical illness, we all have mental health. So it's just about that, really, and helping people become more aware of it in the workplace and more susceptible to being able to talk openly about it.
Thank you, Pat. So mental health is a major issue, and it's getting loads of press. You probably will all have seen this week, the popular 111 helpline has launched their own mental health option via the phone. Some latest stats just to set the scene and get us all thinking. So I found these online. Mind UK, thank you for some of your stats. 1 in 4 people experience a mental health issue each year in England, is a 2024 stat. 1 in 6 people report experiencing a common mental health problem like anxiety or depression in any given week. But only 13% say they're comfortable discussing a mental health issue at work. And only 34% of employees say that their company they work for even has a mental health policy. So some really big stats for a big topic. In terms of the format of the webinar, Pat's going to take us through some slides. And the real focus there is about giving managers practical tips to help when faced with mental health issues in their teams. After Pat's slides, we're going to do more of an open Q&A between Graeme and Pat. If you've got any questions as we go, pop them in the chat window, and then I can hopefully pose those questions to Pat and Graeme towards the end. So part of our technical issue was Pat being a share screen. So I will share Pat's slides, and Pat, just give me a good old nudge when you want me to move to the next one. So let me just share my screen for everybody. And also, just so you're all aware, we're going to share the video afterwards of this webinar, so that you can forward it to colleagues or whatever. Right, hopefully everyone can see that. Pat, you can see the slides?
I can, thank you, yeah.
Great.
If you want to go to the first slide, then that'd be great. We're just going to cover a few topics within the session that we have today. And really, it's about talking about those differences between mental health and mental illness. And yes, there is a difference. We look at things in terms of managers' duty of care, signs and symptoms, and how to have those really sensitive conversations, sensitive but necessary conversations in the workplace. We're going to look a little bit at the manager's role and tasks, and again, for managers, how to signpost appropriately. Now, I know you will know a lot of this. It's just about revisiting it and refreshing our knowledge, really. So thanks, Matt. Next slide, please. Sounds awful, doesn't it? Next slide, please. Okay, so mental health, what is it? We all have mental health. There's no mental health without mental health, basically. We have physical health, we have mental health. Mental health is our day-to-day barometer, and it can be impacted by many, many things throughout the day. You can start the day in quite a good mood. You get to the office or wherever you're working and everything is fine. You get a difficult phone call, you get a challenging meeting, and throughout the day, your mood can drop. So our mental health is our day-to-day barometer that can change throughout the day, but it can also be impacted by many other things. You might be worried or anxious. You might have some family problems or financial problems, or there's pressure in the office. All of those things can contribute to our mental health. You could have had an illness, a physical illness that is affecting your mental health. So we all have it. Mental illness is different. Mental illness is around a diagnosable issue. So it can be depression, anxiety, bipolar disorder, all the common mental illnesses that you know about, but it has to be diagnosed by a qualified medical professional. And sometimes callers to Care First will say, oh, I'm really depressed and I'm really down and I'm really low. Well, depression is a bit more than a low mood. It's much more serious than that. And so what we at Care First would say is, have you had a diagnosis? Have you seen your GP? Who's out there that you can talk about this to? So the most common things we see at Care First are depression and anxiety. So if you want to go on, we're going to look at employers' duty of care. And there are 3 points. And I think the third one is really important here and is very much overlooked. So the organisation has a duty of care to you. You as a manager has a duty of care to your staff, but most importantly, each one of us has our own responsibility for our own mental health. So it's not just enough to keep ourselves physically well to do the difficult and demanding jobs that we do. It's also essential that we have that mental robustness to be able to manage our own mental health well in the workplace. And part of that as an individual, if you're living with a mental illness or you're struggling with your mental health, it really is our duty of care to ourselves to be able to talk to our manager or identify someone within the workplace that we can talk to. Managers, be they ever so good at managing, are not always great at mind reading. So it really is about the individual saying to their manager, just feel a bit off, something doesn't feel quite right. So whilst we're talking about employers' duty of care and putting it all on the organisation, we do have to take individual responsibility for our own duty of care. Next slide, please. So it's not just about a safe place to work or a safe system and safe equipment. It's also about safe and competent colleagues. Now, what do we mean by that? Well, just as you would do if you have someone coming into work following surgery with their leg, perhaps they've broken a leg, they've got their leg in plaster, you're not going to have them rushing up and down the stairs. It's not going to be safe to do so. But you don't see necessarily someone with a mental illness. So how do you ensure that they're safe? How do you ensure that they're competent? Well, you talk with them exactly in the way you would if someone returns to work after a physical illness. And I'd say to managers, don't be afraid to have those conversations. They really are necessary. Okay. So what might you notice as a manager? You may notice this in yourself or indeed your colleagues. You might feel sad or down. You might not have any energy. You might think, oh, I just can't go into work today. You might be confused and think, I can't do this. I just can't concentrate. It feels as though everything's closing down. It feels as though I'm being suffocated by all this stuff that's going on around me. You might become really fearful. We often know that people with anxiety feel fearful of going into the office some days. I don't want to go in today. Something bad might happen. We also might have this extreme mood change. We might be hyper one minute and then low and depressed the next. And one of the things managers might notice in the workplace is when someone starts withdrawing from the team or withdrawing from friends or not going out to the team activities. That sort of thing, it is a key sign for managers to spot and to start those conversations. And in ourselves, we might feel really low energy, really tired, and really having problems sleeping. So just look out for those things. And those things are good. Those signs are good things to talk about. You know, I've noticed when you come into the office that you look really quite fed up with it all. Is there anything I can do as your manager to help you? I notice you're not coming out on any of the team activities. Is there something going on that I can help you with? Don't be afraid of having those conversations. Okay. So you can also notice other things in staff, such as a change in appearance. They might be dishevelled. They might be taking leave at short notice. They might come in late. They might want to finish early. They might be isolating themselves. They might be late. They might not give you a reason for why they're being late. And they might be quiet and withdrawn. And you might say here, well, we see that a lot. Yes, you do. But it's about knowing the individual, knowing your staff member and noticing if anything's different. Now, we all know that people with significant mental health issues and mental illnesses are very good sometimes at hiding those symptoms, hence the need to have those conversations with staff. No matter how complicated or challenging you might feel they may be, it is about sitting down with a person and saying, what's going on right now? How can I help you? Next slide, please. So the common mental illnesses that we see mostly at Care First, and you will see as managers also, is depression. And that's very different between feeling down or low or unhappy. It's a long-term condition. It's considered a disorder. And when something's a disorder, we talk about it impacting us in several ways. It impacts what we feel. It impacts how we behave. And it impacts the way we think. And those three key areas are when we know that something is really wrong. It impacts everything around us. It impacts the way we feel about things. We talk about things. We feel hopeless and helpless. And it always needs a diagnosis from a qualified medical professional. You can't just come in and say, oh, a bit depressed. Depression is illness and it needs treating by a medical practitioner. And that treatment can be wide and varied. You can have talking therapy, you can have medication, you can have a mixture of the two, whatever you and your GP decide on together. But again, don't be afraid to have that conversation. You can say to people, you've returned to work, you've got a diagnosis of depression. How does that manifest itself? How can I help you in the workplace? How can I be alongside you if something like this occurs in the workplace you need help with? Do you know you can come to me as your manager? Do you know where you can go to for help? So there's lots of things to aid those conversations. Okay. And the next one we see a lot of is anxiety. And this is different completely from feeling anxious about one particular thing. We might feel anxious about doing a presentation. We might feel anxious about talking to new customers. We might feel anxious about going to the dentist, or anything can cause that anxiety. And that's part of our fight and flight mechanism. And we all know about fight and flight. The majority of people who phone Care First suffering from anxiety usually phone when they're in that freeze stage. They've got no energy to fight. They certainly haven't got the energy to run. So they freeze and they're like a rabbit in the headlights. They're just staring and don't know what to do. And that again can be considered different from the normal run-of-the-mill anxiety, which is good. It's our fight and flight symptom that tell us, uh-oh, something might be happening. We need to run. We need to keep ourselves safe. So it's a good thing. However, when it takes over our life to the point we don't want to do anything, we don't want to say anything, and we don't want to see anyone, it becomes a disorder. So there's a marked difference between being depressed, depression, feeling a bit anxious, and an anxiety disorder. What really is useful as a manager is if you know someone in your team is living with anxiety, Try and talk to them about the triggers that might spark that. It could be they have to give presentations and they've told you, I just can't do this, I'm really too anxious. Talk with them about that. Find out what the triggers are, and that will help you help them in the workplace, and they can still be very, very productive members of the team. So just because someone has a mental illness doesn't mean to say they're not good and productive people. Okay, thank you. Now, this always seems a bit complicated, and I say to people, please don't feel overwhelmed by it. It's a very simple and useful aid to managing professional boundaries. Managers often say things like, oh, I'll take him down the pub and have a chat. No, no, please don't do that. Keep it professional. So what is the difference? What do we do? So the manager's role is going to stay consistent throughout. So the manager's role is to be that of manager, not neighbour, not friend, not pal. You really are there to be the manager. Your tasks, however, are going to change. So in your role as manager, before you see the individual or talk with the individual, you've got some tasks. And your tasks are to plan, to prepare, to think about, where am I going to see this person? Is there anyone else in the organisation that needs to know this meeting is taking place? Is it formal? Do I have to have anyone else with me? So those are the prep tasks that you need before sitting down with an individual. During the individual, in your role as manager, you have a few tasks. Could you put the next slide up, please, Matt? Because this will tell us what the tasks are. And the first one is to listen. Now, I know what managers are. I'm a manager myself. We're very problem solution focused workers. We want to give them what they need to do their job. And what we're saying here, the task of the manager is to actually listen to the story the individual is telling you. You may not believe it. You don't have to. You may not like what they're saying. You don't have to. But listen, make sure they feel heard. Normalize things. So if they say this certain thing happened and I find I'm not sleeping very well, or I can't eat, or I feel really anxious about coming in, you can say, you know, sometimes when we're feeling upset or worried about things, it's quite usual not to be able to sleep. It's quite usual not to be able to eat and to feel anxious. And that helps the individual think, actually, I'm okay here. Nothing wrong. It is normal to feel these things. And they start to feel more enabled to talk to you. Facilitate. If someone's angry about something that's happened in the office, you can facilitate that. Yeah, I can hear this is difficult for you. Yeah, sometimes it's like that. And you know, when it gets like that, it's okay for you to come and talk to me and tell me you feel upset. Tell me you feel anxious. And if I can, I will do everything I can to support you. Hence, maintain professionalism. Don't take it on yourself. You're not a counsellor. You're there to manage this situation. And finally, your task at the end of the intervention is to think, what do I need to do next? Maybe I need to refer. Who do I refer to? Who do I signpost to? Do they know about the employee assistance program? Do they know about the lifestyle page? Do they know about mental health first aiders? What can I do as the manager? Could you go back a slide, please, Matt? So this role and task analysis is there really to keep you, the manager, boundaried and on track. Your task, plan, prepare. Where do I need to go? Who do I need to talk to? Does anyone need to know that I'm there? What is the purpose of the meeting? During the meeting, my task is to listen, to normalise, to facilitate, to maintain professionalism. And at the end of the meeting, I summarise what's been happening, and if appropriate, I refer on. Now, this will stop us intervening too soon. This will stop us going and speaking over the individual and telling them what they need to do. People tend to respond more appropriately if they drive the outcome. And as managers, we're often saying, have you thought of this? Have you tried that? Have you done that? Well, if the individual has already tried all that, we will just cause more anxiety and more frustration by going over the stuff they already know. So ask the questions, remain separate in your role as manager, and identify the tasks that you need to do before, during, and after the intervention. Okay, Matt, you can go forward too now, if that's all right. We will return to this. So how are you going to have this conversation? You know they've come back to work, you know they've got a diagnosis perhaps of a mental illness, or you know their mental health isn't too good. So what are you going to do? How are you going to talk to them? Well, there's a series of really helpful questions, and no, they're not counselling questions, they're good management questions. So when someone says to you, actually, I'm really anxious, I don't want to be in the office, I dread coming in, this is going wrong, that's going wrong, I would say as the manager, so when did all this start? When did you start feeling like this? And what you're listening for there is the trigger. Now, it could be they say, well, it's been like this ever since my child's been ill, and I'm really worried about coming into the office because I'm not giving my child the time. Or it could be a financial situation, or it could be a whole host of things. So what started this? When did this all start? That gives you the clue to what's been going on. And you remember one of the previous slides when I talked about mental health, you're looking at mental health and thinking, actually, that can be triggered on a day-to-day basis by all this other stuff. So their poor mental health might be they're in financial difficulty. They don't want to come into the office. They've had a relationship breakdown. They've had a bereavement. They may have been physically ill. So all of those things can be the triggers. And you can say something next like, well, when did all this start? When did you first notice something was different? And that's where they might say, well, I dream about work in the night. I dread coming in the morning. I dread seeing my partner when I come in from work. And they will tell you some of the symptoms. I can't sleep. I can't eat. And that's when you normalize it and say, do you know, if something like that happened to me, I might feel like that too. I don't know how you're managing that. How can we help? And the next question along there is really, okay, so you're back to work. You've told me you're living with a depression, and I can't imagine how difficult that can be from time to time. So tell me, as your manager, at your worst, how bad does it get? And then you're doing a rough assessment. It's really a rough a risk assessment. When they say, oh, I just don't want to be here anymore, what are they actually referring to? Are they saying, I don't want to be here in this job? Or I don't want to be living here? Or what do they actually mean? And you can explore that. At your worst, how bad does it get? And you hope they say something like, well, I just don't want to be in the office, or I just want to stop for 10 minutes and take a break. If they say, I don't want to be here, people would be better off without me, then you might have to think again about how you're going to proceed. But don't be afraid of it. You can say, at your worst, how bad does it get? So within the workplace, do you know how to reach out for help and support? So this is in terms of saying, what comes next? So you've told me that you've got this difficulty. You've told me how it started. And within the workplace, we have lots of things set up for you. You can come to me as your manager. You can go to the mental health first aiders. Let me direct you to them. Let me direct you to the EAP. Be alongside the individual and help them find out what it is they need to do for themselves. And I would then say, okay, so you have these anxieties coming into work. What would help you most? What is the thing that would help you most in the workplace? And they might say, well, actually, what would help me most if I can just come and chat to you for 10 minutes? Or what would help me most if I can just go for a quick walk? Or what would help me most if I can just change my working hours for a week or so? That's the sort of thing you're trying to get there. And I would then say, and as your manager, what can I do differently to support you? What would help you most right now? And that stops the individual whirring around and going on about past historic stuff. It brings it right down to now and say, okay, as your manager, what can I do to help you most right now? And that's when they say, you've listened, that's all I need. I now know where to go to for support. I just want to sit down and have a cup of tea. So you don't have to make it terribly complex. It's not a therapeutic intervention. It's a good management tool to help you deal with staff's mental health. And we should all be able to do this with some confidence. And it takes time, it takes practice. But those few questions are really going to help you get underneath what's going on for the individual. Okay, next slide, please. And we all know the 5 simple tips to good mental health. And that's the 5 things that we've got there: the good nutrition, the sleep, the self-care, and the exercise. But when you're feeling miserable, it's really hard to do those things. Sometimes we forget because of the overload of work. We forget to eat lunch. We forget to get up from our desk and walk around for a while. We forget to take care of ourselves because we're always doing for everybody else. And like they say on the aircraft, you know, in the event of a pressure change, put the mask over your own nose and mouth before you help the person next to you. And that really is something we should all do. We should learn to help ourselves. We should build on the resilience we already have in order to initiate that self-care. What do I know about me that's going to get me through this? Well, I know about me, I've got a reasonable sense of humor. And I know about me, I'm strong because I've had to be strong in the past. And people should be trying to think of that for themselves. What do you know about yourself that's going to get you through this difficult or demanding challenge we have in front of us at the moment? Yeah, so those are just 5 simple tips to mental health, and we all know what they are. Okay, next slide, please. And of course, those of you that know, in Use Care First, we have the Care First helpline there for you. Now, that was a very brief overview of helping people in the workplace, but I hope it's given enough food for thought for there to be some questions if needed. If so, please feel free to ask them, and we will do our best to answer. Thank you for that, Matt. That was very helpful.
No, thank you, Pat. That's really great. And personally, as a manager, found that really useful. Just some actionable things and some great tips. So we're going to go now to the Q&A. As I said earlier, any questions that people want to pose that have dialed in, please add them into the chat. But I'll start with the first one. So I'd like to understand from the panel, it goes back to one of the stats I raised earlier, that apparently only 13% of employees feel comfortable going to their manager with a mental health issue. And the question is, why? Why do you think employees don't ordinarily come forward to their company to explain that they're suffering before they go off sick?
Yeah.
So Graeme, do you want to give your thoughts on this one first?
Sure, Matt. Excuse me. I think there's still, as Pat alluded to earlier, there's still a certain element of stigma. I think there's also a certain element of people not wanting to let colleagues down. I think generally people don't want to come forward to their manager because A, the manager might be part of the issue, and B, I don't think they're always comfortable with their employer knowing that they've got some sort of form of condition. So I think it's almost an embarrassment to some people to come forward, and sometimes they're not sure if they want their employer to know about their condition in case, in some terms, it could be seen as predicting them against the organisation. And again, it comes back to some of the things that Pat said, is having an open culture, a culture where somebody can come forward to their line manager. But the line manager is a very, very important part of the situation because so much time and so much effort is spent with the line manager in terms of support. So again, it's creating that culture, but it's a very scary statistic that it's so low, people feeling comfortable that way. So it's really how the organisation can change that, how the organisation can make it okay to come to a manager and ask for help.
Can I add to that, please?
I was going to say, Pat, one of the things Graeme touched on there was the culture. How important do you think is it for managers and for senior leaders to actually be open about their own mental health to set the tone?
I think it is. We always talk about, particularly when we're dealing with stress management, is what do you do in front of your team that demonstrates good stress management? You know, for example, do you take your lunch break? Are you always glued to the desk and the door shut, or you're glued to the desk and you're so busy you can't talk to anybody? That isn't really demonstrating an appropriateness to go and have a chat with the manager when they're always too busy to listen, you know, and we know how busy the workplace is. I think the other thing, they don't want to go to their manager, not just because of the stigma, but because they think, well, the manager can't do anything about it anyway, so what's the point? You know, that very much is what we hear. No good, go to my manager, they're not going to listen. And that's why I think managers, anyone that manages a team, or even us as individuals, hence the duty of care, is that we have to demonstrate good management of ourselves within the workplace. We can't go stomping around when something goes wrong. You know, we have to just be there and talking about it. But I do understand that people don't want to talk to managers for the reasons that you've said, Graeme, and also because we feel embarrassed. You wouldn't have a problem phoning in the morning and saying, I'm really sorry, I can't come into work today, I've got a really serious gut bug. But you wouldn't phone up and say, actually, do you know what, I'm suffering with a bit of anxiety today, because you know what the response would be. So having an open culture, doing well-being days, wellness days, bringing the mental health first aiders, all those sorts of things can do away with some of that myth around mental health and mental illness in the workplace.
Great, thanks, Pat. We've had our first question from the chat. So this is from Alina, and one of you guys just jump in and let me know who wants to answer it. So the question is, how do companies best approach cases where employees are signed off with anxiety or stress by their GP for several months, and they're actually, you know, refusing to actually cooperate with the company and maybe share and come back to work or talk about what's going on? So they've been signed off long term by their GP. What's your advice to employers?
I'll maybe pick some of that up. Again, I think it's going back to the rules that Pat talked about in terms of the manager's role. If that meant a domestic visit to the person's house, that's a possibility as well. Some of this in terms of taking care of somebody who's off in a long term is quite complex, because if you've got some form of insurance in the background, that makes that a much easier scenario. But if there isn't any insurance, it doesn't mean that private treatment, in other words, quick access to treatment, couldn't be facilitated, but it would have to be done on a spot payment. And whether the company wanted to do that would probably depend on the individual, the policy, grade, various different issues. But certainly if health insurance is in place, it's an awful lot easier to try and request somebody to take treatment on board. But again, it comes back to what Pat said. There's nothing wrong with challenging that individual or talking to that individual, even if that requires a domestic home visit. I don't know if you want to add anything, Pat.
Yeah, I think the keeping in touch is like, oh my goodness, do we do keeping in touch? Yes, you do, as long as you're not harassing the individual. Someone asked this in the webinar last week. What do we do? Well, I would say if you have a policy around keeping in touch, it's okay to phone now and again to find out how that individual is, or better, find out how that individual wants to be approached. You know, do they want a text message? Do they want a phone call? Do they want a visit? And also to do little things to encourage the individual back into the workplace. Don't go and meet them in a coffee shop, because if the issue is going into the workplace, you need to take the person into the workplace to try and address the issues that led them not to be there in the first place. It's also about having the this is a really difficult one. We talk about capacity and capability. If that person did a really, really good job up until they became ill for whatever reason, we have a duty to help that person, enable them to get back to full capacity to do the job. You can't discriminate against someone because of their mental health. However, if there is a capability issue there, then that does have to be dealt with. And if that's separate to or as well as the anxiety, again, HR need to be involved and help and guide you through that, I would say.
There was one other piece there in terms of the issue that was raised, is quite frequently if somebody has an addiction problem, that scenario is pretty obvious. And we still have to find out whether the person has to have a discussion to actually say they've got an addiction problem if they want support and facilitation and referral. But that can often be a commonality to that particular issue.
Right, thank you both. We've had our next question. This has come from Ash. They're interested in hearing what advice you can give them really as an employer to supporting individuals. So this is the employee who's going through formal cases such as a grievance and disciplinaries. So along with occupational health support and buddy systems, do either of you have any advice or suggestions on how to make the process as comfortable as possible for the employee whilst remaining professional, obviously under difficult circumstances?
Actually, I think this is a good one for Graeme, but I would just draw your attention back to the role and task analysis. Remember your boundary in that, and the tasks would be the same. You have to change the task all the way through it. But I think that's probably a better workplace management question that Graeme could answer. Sorry, Graeme.
No, I think you answered it really eloquently. That is the answer is to keep having discussion and not deny access to be able to talk to the individual. I think the tools that you used in terms of occupational health, I'm not overly impressed that would necessarily do anything, because an occupational health referral will probably result in a report, and I would imagine that information would already be well known between the individual and the employer, making an assumption there. But really, it's just not denying access, being there for the individual, and I think somebody suggested there a buddy scheme, but it's a very, very difficult process to go through, but it's just being there for the individual and not letting them feel they're alone or they're isolated.
Absolutely. No, I think that's really makes a lot of sense. Next question. And I've personally seen this in the workplace, so I'd be really interested to get your feedback. So the question is from Tracy, what's your advice for dealing with somebody who they're refusing to go off work because to their mind, if they're not at work, it's going to make things worse, but they have been advised by a clinician to say they need to sign off sick. So they're just they're not following the advice really, because a lot of people are tied to work and they feel like that defines them, and maybe they feel that being taken out of the workplace is going to make whatever's going on even worse. But what's the advice you can give to an employer in that situation, or a manager in that situation where the individual's not taking the advice they've been given?
Well, that comes back to the safe and competent employee, doesn't it, really? That's one of the things around the duty of care. You have to provide safe and competent employees. And if they're not well, then you have to address that. And also, I think if someone's signed off with a medical certificate, I might be wrong, you do have to get signed back on by your GP. And I think there may be insurance issues there or liability issues. So it's about checking the policy very carefully around that, I would say. Again, Graeme, you've probably got more experience of this than me.
No, I only agree with you, although that could be an opportunity for a request for the individual to go for an occupational health assessment. Because with a very low cost, you're probably talking £400 or £500, a very low cost. With the consent of the individual, you can see the report yourself as a manager, and 9 times out of 10, I think the occupational health practitioners would follow what Pat said, and wait for a fit to work return certificate before they would be allowed back to work.
There's one other thing we have to remember too. It also looks at the company sickness policy, if indeed there is one. If someone's not paid, if they're off work, statutory sick pay in this day and age is not going to cut it. You know, they're not going to be able to pay their bills. So they might be the only person earning in the family. They might think, I've got to go to work no matter how ill I am, because if I don't work, I won't be paid. So I also think we have to look at that very carefully as well.
Absolutely. Next question from Amy. I remember when I first started out as a manager myself, this was definitely a factor for me. So how do you advise managers in kind of best managing their own mental health, whilst also looking after the needs of their team? So I think, you know, as a new manager, you can find it stressful to have that extra responsibility for other people, especially now, you know, based on this topic, you know, managers are expected to look out for and help people in their team with mental health. But how, if that impacts your own mental health, are there any coping strategies you can think of over and above just the basic ones around sleep and nutrition and everything, in terms of maybe framing it so that they can cope better?
Yeah, absolutely. It again is looking after your own mental health. And the thing that does that best is self-awareness. How aware are you of how you react to stress, to anxiety, to feeling a bit down yourself? Because that will really help you help someone else. Remember, mask over your face first before you help anyone else. Demonstrate good mental health behavior. Take your breaks, do lunch, all those obvious things. But also, I think in your bid to be a good manager, you might be a good manager in terms of the product, but you've got to look at your people management skills as well. How am I going to go about this? And I would look at a model by Robinson Cooper. I always want to say Robinson Crusoe, Robinson Cooper, and he talks about this resilience model where you're in the middle, and what helps you get your resilience? Well, you get your resilience from confidence, from social support, from all the things you've done in the past and perhaps fallen at. It's not how many times you fall, it's how many times you get up. So it's about making sure your own mental health matches your physical health. And it is, I'm afraid, those basic things like exercise, modeling good stress management behavior, and not being afraid to talk about your own stuff occasionally too. Just, oh, you know, not feeling so great today, this has happened. And if, obviously not moaning and becoming a burden to the team, but by saying something like that, the individual thinks, well, actually, if she can say that, or he can say that, maybe I can. And as a manager, what I would be doing is reaching out and saying, do I have mental health first aiders in the company? Who are they? Where are they? Where can they do an awareness session? So we can all benefit from it, really.
Absolutely. And the thing I'd add, again, from our experience at each person, is, you know, it's about creating the culture within your team that, you know, is going to best benefit you as well for your mental health. You know, there's loads of scientific research to show that when people actually engage in recognition and appreciation, that it releases dopamine in the brain and it makes you feel more positive. And what was most interesting for me, and the latest thing I read, was that's equally true for the person giving the recognition as the ones receiving it. So I'd say if you're a manager, you should try and really lead by example and celebrate success, appreciate your team often, create that sort of environment, and they'll appreciate you back. And either way, it's going to boost your mood and make it more enjoyable.
I would also add, not with a mental health background per se, just as a manager background per se, as somebody's fairly relatively new into a managerial role, they should seek a mentor. And if that looks like that's difficult to do within the organisation, speak to the CEO or the MD or somebody senior in the team to try and find an external mentor. But a mentor is an enormously valuable asset to somebody coming through a managerial role. Hugely important.
Absolutely. Another question that I thought would be interesting to get both your take on. It comes down to, I suppose, the question of confidentiality. So what would your advice be to a manager when they've heard in confidence that there is a mental health issue. So they've been confided in, or they've heard it secondhand. So it's not common knowledge. And the individual that it relates to isn't putting their hand up and shouting about it and being open to everyone else, but they are pretty certain there is an issue, but they don't want to break the confidence maybe they've had that this person's confided in them. What would be your advice to how they manage that situation?
Try and witness it for yourself. I mean, you've got to be very careful with confidences, because we certainly have at Care First been called into organisations where someone has taken their own life, and they said to a member in the team, I feel so bad, I think I want to end my life, but I don't want you to tell anyone. And the individual didn't. And then they went to another person and said, I feel so bad, I want to take my life, I don't want you to do anything about it. And they didn't. And the person did take their own life. So we ended up with a massive team all feeling hugely guilty that they'd kept this confidence. So if someone came to me and said, I think they might be struggling mentally, nothing to do with suicide, I hasten to add, I would be trying to witness that behaviour or get that sense for myself, because nothing is worse than saying, oh, so-and-so told me that you were feeling miserable. I would have that conversation and say, just get a sense something's not quite right. Is there anything I can help you with? Don't be afraid to have that conversation, really, and say, I've noticed this or I've noticed that. Don't take third party word for it, because it might not be accurate. Try and put yourself in a position to witness it for yourself.
Could I please ask, Pat, could you possibly give just a little bit of advice around what we've just talked about in terms of if somebody has intimated ideation of suicide, just what should be done, like in an emergency side, just might help the group?
Yeah, well, if someone said that to me, I think I've thought of taking my own life. I've got a mental health background, so I would probably deal with it differently. But I think if the person's in your office, you do have a duty of care. You can't take that as a confidentiality and not do something about it. And you would have to say, look, what I would do is I'd say, look, I can hear what you're saying, and it sounds to me as though you're going through a dreadful time. I can't imagine how difficult that might feel for you. You told me you wanted to end your life, and I'm really worried about that, and I care about you, and so I am going to have to do something about that. Now, with your help, I would rather us phone a family member or phone your GP or get you to a hospital, but I can't hold it as a confidentiality. I can't hold it as a confidence. I have to do something about it. Now, this is where you've got mental health first aiders in the business who have done quite a lot of extensive training around this, and they would be talking about just moving that individual from the moment on. So they might say something like, look, I've heard what you said and it sounds absolutely dreadful. Goodness knows how you're managing it. I don't think I would be able to manage it either. However, would you believe me if I told you with the right help that could change? And you only have to move someone a tiny little bit to bring about a change. So A, I wouldn't keep it as a confidence. B, I would ask for help. And C, I would tell the individual that you've told me something that is too important for me to ignore. I'm going to have to get some help and advice with that, and stay with the person, not to put yourself at risk, obviously. Don't go off in the car with them or anything like that, but stay with them until help is summoned. If you phone an ambulance, they cannot force anyone to get into an ambulance. And unfortunately, the only thing one would have to do if it was imminent would be the police, because they can move the person to a place of safety. But that isn't something you'd want to do, is it, Graeme? You don't really want blue lights coming on and someone carted off in a police van. However, somebody can refuse to get in an ambulance, but they can't refuse to get into a police car. And they would take them to the cell, which is not the best place. And they'd wait for a psychiatric and a doctor's and a social work assessment as well. So don't accept it as a confidence. Tell them you care. Tell them you will help and support them. Tell them you will help them get referral to appropriate help. And then do whatever your suicide policy in the organisation tells you to do. I hope that's helpful, Graeme.
Super. Thank you. Thank you so much.
And maybe this is one for you, Graeme. I mean, are there any ways of fast tracking an employee into assessment and treatment if you are worried about them?
Well, I think the situation at the moment is we know that the NHS is under an incredible strain at the moment, which is unfortunate for all of us. So there is the option in the private sector, and morally that doesn't fit with everybody either, because it's a fast track into a private scenario with the same consultant, same psychologist. But going down the private sector, if somebody was really concerned, certainly to get to an assessment would probably take less than 3 or 4 days. Whereas if they were going to the NHS, they would join the queue. As Pat eloquently said, if somebody was an emergency, and I'm not suggesting people are doing this, but if they actually appeared in an A&E, they would be attended to. But for a normal assessment, it could take quite a long time. Some of the assessments in particular, which aren't emergency, like ADHD, for example, there's quite a long waiting period for assessments in most regions across the UK at the moment. But certainly, again, if it was private, that could be done very quickly. It's not always requiring a stress. It's not always requiring health insurance. Some of these assessments can be purchased fairly relatively cheaply. And people sometimes get scared. Inpatient treatment in a private mental hospital is exceedingly expensive. You know, it's going to be over £24,000 for a month. But outpatient treatment isn't necessarily as expensive, and assessment isn't necessarily expensive. And you're talking, you know, for 10 sessions of therapy, less than most people would pay for an average holiday per annum. So there are ways of doing it, but I don't like saying go down the private route, but it practically is quicker. I just hope that we can get more funding to the NHS to enable more people to get proper service.
I also think the one thing to remember here is if that person does want to end their life, no matter what you do, they will still find a way of doing it. So the guilt that people feel, you know, if someone was determined, they do it in secure hospitals, they manage to take their life. They do it in prisons, they manage to take their life. If they're going to do it, they will do it. What isn't helpful is guilting them out about how would their family feel. That isn't helpful. It's about saying, this is this right now, and within an hour, things could change. Let me help you with this. If they're going to do it, they will do it, but don't ever keep it as a confidence.
Okay, we've had another question, and this comes from Ella. So this would be, what are your opinions on implementing well-being days in organisations?
Brilliant.
And how many days would you recommend? Is it eligible to all? Just any experience, any thoughts on the topic of well-being days?
Depends what you do on a well-being day.
Could I add to Matt's question as well, if you don't mind, Pat?
No.
We've talked a lot about first aid, mental health first aid, and I don't think anyone in this call kind of missed how important that sounds. How people can they actually access it?
They can access it if they've got mental health first aiders within the office or within the business. They should be well advertised. You should know who they are, where to go. Those mental health first aiders should be part of a wellbeing day. They could do a presentation. They could wear a badge. You know who they are. We've got them at Care First, and you need to get training in to get a group of mental health first aiders if you haven't already. I hope this sounds like advertising. We do deliver those courses at Care First, I also hasten to add, but it is something that most organisations have now. And a wellbeing day is only as good as how much you're going to put into it. It doesn't mean money necessarily. It means, is it going to be well supported? Is it going to be well advertised? It's not just a place to go and get loads of giveaways and, you know, things like that. The people don't want another pen or a stress ball. They want something a bit more meaningful, you know. So there's all sorts of things you can do on a wellbeing day that doesn't have to be a boring 50 stands with more pens and stress balls than you can possibly manage to take home. You know, it's about being there and being active and asking people, what would you like to see in your wellbeing day? It might be something like the 5-minute chair massage. It might be something like a juice bike. I know we used to do them a lot where you've got somebody pedals like mad and you throw fruit into a container and it whisks it up and they get a smoothie. That sort of thing where people are feeling they're participating. You know, wellbeing day is great, but don't have them just for the sake of handing out leaflets and pens and, you know, make them more meaningful to the individuals. Get the mental health first aiders in, get everybody in that can make people feel better. We used to work with a university down south who were brilliant. They had celebrity chefs in and would teach people how to make healthy meals. They had juice bikes, they had craft, they had pottery, you know, you name it. It was a really good day. And everybody attended. They ran them over 2 consecutive days. And, you know, I'd been to all of them and they were absolutely packed every time they did them. They did 2 a year. And that worked really, really well.
Great, thank you. I mean, staying on this topic, we've got a message from Lauren. Other than having trained and designated mental health first aiders, are there any other initiatives or resources you could help? So Lauren goes on to say that they have a team of mental health first aiders. They try and meet once a month to discuss what's going on whilst remaining confidential with the information, but it's a bit flat and they're probably not getting the most out of it. So are there any thoughts on how to make that come to life a bit more and make it more meaningful?
yeah, certainly wouldn't do one a month. I would say one every 6 weeks. Get a rota going, who's going to get an inbox where people can approach mental health first aiders confidentially, take it in turns to be on there, get a mental health first aid instructor in to talk every 6 weeks to say, what's the current theme and trend? Let's remind ourselves of the algae model or whatever else they're going to do. Get somebody who knows what they're doing to facilitate those meetings, because you might not have seen anybody in a month. You might not have spoken to anybody. So it's a bit of a waste of time. Have them every 6 to 8 weeks. Get someone along to talk, anything that spices them up a bit and gets people more engaged with it. And again, I'm not going to say it. Yeah, do whatever you can to make them interesting.
Great. I mean, we talked earlier in your presentation, Pat, about depression and anxiety. What other mental health illnesses might managers and people on this call potentially come across that maybe aren't as well publicised in the press?
Yeah, bipolar disorder. That's quite big. It takes a long time to diagnose because people only go to the doctor when they're in their very down mood. They don't go when they're life and soul of the party. So it's cyclical. You have to sort of say, how long has this person been in this state? How many months, how many weeks to get an accurate diagnosis? We're seeing psychosis coming up again, where people are hearing voices, people are really struggling. But again, none of these mental illnesses should exclude people from the workplace if they're properly treated and properly supported. Another one that comes up at the moment that we have lots of gender dysmorphia going on as well. That sort of calls are coming up, not helped by social media either. So there's so much coming up. And I know that we only look at the most common ones. There are so many more out there. And again, get your knowledge in, get the mental health first aiders on it, give managers briefings. We run 2-hour sessions or 2-3-hour sessions just for managers, because whilst the mental health first aiders are brilliant at listening and helping the individual in the moment, what they can't do are things like making reasonable adjustments for people. So it's only fair and reasonable that the managers not necessarily have the mental health first aid training, but have some knowledge of how to deal with the basic mental health stuff within the workplace, so that they can get the right support in, and they can adjust hours for a short space of time if needed. They can do more than the mental health first aider. So short sessions for managers, we do 3 hours, I think it's 2 or 3 hours we run, and it gives managers quite a comprehensive overview. They also look at the questions to ask and how to do it. It's all supported by video evidence as well. So lots that we can do to help and support with that.
Can I just add as well, in terms of common illnesses coming through, I'm stating the absolute obvious here, but the earlier somebody can be helped, the better. Common illnesses, things like attention deficit disorder, hyperactivity is very, very common in adults now, becoming common. Not much you can do about that, but something like an eating disorder, which has effectively been developed over a period of time. I ran a hospital and I had 25 young ladies with an eating disorder, and for a long, long period of time. Outpatient, so much better than inpatient. Anything we can do to help somebody as early as we can in their journey, so they don't end up being an inpatient in a facility for something that's a kind of fostered illness rather than something that's genetic or hereditary, would be preferable.
And that also goes to sort of self-abuse, self-injury. Eating disorder isn't about the food, it's about the control they have. So again, that's part of anxiety, part of phobia type behavior. So yeah, really important to recognize the signs and symptoms of that.
Well, that actually leads on to the latest question we've had in, which kind of leads on from the suicide discussion we had. Any advice when a manager or a colleague realizes someone's self-harming?
Well, yes, if they see it, then they should be able to say, I noticed this. Do you want to talk to me about it? Is there anything I can do to help and support you? Self-harming, if you're talking about cutting and things like that, lots of people do that. It's very, very common. The only risk of that is that, and I know this sounds really bizarre, but I know there was a big campaign a while ago that for people that were self-harming, they could get sterile implements such as razor blades and things like that. I mean, it sounds bizarre, but the biggest risk in self-harming if people are cutting is infection. So whilst people aren't stopping the self-harming, they are giving people tools to make it more safe, which sounds bizarre, but it's absolutely accurate, isn't it, Graeme? I'm sure you're aware of that. Any self-harm isn't about anything other than control. So it's trying to find out what that's about. And that needs a skilled professional. We as managers shouldn't be dabbling in that, really. Just point out what help is available, say that you're aware, say you're there if they need to talk, and signpost on to the most appropriate places.
Can't emphasize what Pat said there enough. The self-control. If you speak to a patient who is self-harming, on the action of doing the self-harm, that actually makes them feel better.
Yeah.
So when somebody comes in and who's not empathetic in any shape or form, and gives that person a row or a lesson or direction in life, it really is of no value whatsoever. So what Pat said, getting them to a professional and try and find out what the roots are of that self-control, because giving them some talk to will not make a blind piece of difference.
Pat, you mentioned at Care First you're getting more calls around gender dysmorphia. I read as part of a recent study that apparently the LGBT community are 2 to 3 times more likely to have mental health issues than heterosexuals. Do you see that in terms of the volume of calls you're getting, but also do you have any thoughts on why that might be? And is it the role of the culture within businesses that needs to change to make it more open around issues around gender?
Yeah, it's all of those things, really. We're not necessarily seeing that many calls around that, but in the training I do, without exception, it's always mentioned. And again, it's because it's different. People are frightened of difference, and it's about embracing it and saying we live in a very different world now. We have all sorts of people from all races across the country, everywhere. And it's about being accepting to all and not discriminating against anybody. That's what I find most difficult, that people are still very, very discriminating about so many things when it's just how it is. And we, of a certain age, don't really like to accept that very much. And I think we have to look to the younger generation to say this is what it is, and this is how the world is now. And we have to be accepting of that. But the LGBTQ plus community are more likely to experience mental ill health and illness because they're discriminated against. They don't fit into society as we see it. And so, of course, it exacerbates their poor mental health.
Thank you very much. Well, I'm conscious of time now. We've got some people dropping off. Maybe would you mind both of you just doing a quick summary of, if you had to give a high-level summary of the conversation and just your view on what managers and organisations need to do to help best protect their people. And I know people have come in late, so a roundup from both of you would be brilliant.
Okay. Well, we've looked at the slides. I know the session has been recorded, so you can also watch this back. I would say you can't do enough to help people's mental health and well-being in the workplace. And key to that is actually listening to what the people are talking to you about. If they're going to be brave enough and come to you and talk to you and then be told, yeah, but that's just the way it is, we can't do anything about it. What's the point? What's the point of coming to talk to you anyway? So you can't do enough to improve people's mental health in the workplace. And in terms of well-being, you can do everything you can, throw all you've got at it, because you really need a happy workforce. That's what I would say, really.
Right.
I would agree wholly, and I think Pat's articulated it really well. I think an awful lot of it is around culture and having an open culture and an open door. And for managers to take responsibility serious, every single one of us will have a mental health issue at some point. It's unavoidable, just how it's with. So that manager relationship really is important, because it's the direct relationship. So I think having an open culture, being as empathetic as possible, seek help if you need to refer. Certain things require professional assistance as well as assessment. Thank you.
And finally, sorry, Matt, I was going to say, you used the figures in the beginning, 1 in 4, 1 in 6. Remember, those are only the reported cases. There are hundreds and hundreds that never get to see a GP and are living with the condition without a diagnosis.
Thank you both. Well, so just to answer one of the recurring questions, yes, we're going to email the slides that we're recording to everybody. I'd like to obviously thank Pat. Thank you so much. We overcame some technical difficulties at the beginning, but I personally found your slides really useful and a really meaningful discussion. And likewise, Graeme. And for anybody that does have any questions that they want either Pat or Graeme to follow up with, if you could send an email to support@eachperson.com, I'll make sure that it gets routed to the right person. And I just want to extend our thank you from each person for you dialing in. Hope it was useful. I found it so, and enjoy the rest of your day. Thank you all.
Thank you.